This is Amy. Amy has been the director of nursing at a large nursing home in the Northeast for the past 4 years. Ultimately, Amy is responsible and accountable for the nursing care received by residents. In addition to a very long list of important responsibilities, Amy is also responsible for overseeing the hiring and development of her nursing staff. Like many nursing homes across the country, Amy is finding it difficult to adequately staff all of her shifts. The lack of staffing is not only wearing on Amy, but it is also taking its toll on her current nursing staff, and unfortunately her residents too. Amy is concerned that slower response times due to being understaffed may have negative effects for her residents, such as increased fall risks, as residents try to get up without aid, and increased risk of bed sores, as residents wait longer to be moved. Amy is so concerned that she decides to schedule an emergency brainstorming meeting with her nursing staff, seeking their input to ensure that all of their residents remain well cared for as they continue to search for additional caregivers to hire. Amy also wants to make sure that the camaraderie of her staff is maintained, as her staff's well-being has always been a top priority of Amy's. Amy also invites her nursing home administrator, Ben, to the meeting for his input. Fortunately for Amy, Ben had just attended a popular senior living conference a week earlier where he learned about Seni products. Ben shared with Amy and her team that he recalled a conversation with a Seni rep about how incontinent residents wearing Seni products required less changes and how skin breakdowns could be avoided because of the full breathability of Seni products. Ben suggested that he would reach out to the Seni account executive that he had met and request a free Seni product trial. He shared with Amy and her team that the Seni rep had explained to him that Seni products could actually help with some of the challenges related to the caregiver staffing crisis that we are currently experiencing in our country. Did you know that slow response times is by far the most common complaint from residents living in nursing homes, and the most common reason for slow response times is due to being understaffed? Slow response times can cause residents to fall if they try to move without assistance, or may cause some residents to soil themselves as they await assistance to the restroom. Residents left in bed for long periods of time without being moved may develop skin breakdowns. For residents living with incontinence, the odds of negative outcomes increase even more. Here's how Seni products can help. When an incontinent resident is wearing the proper size product, the proper absorbency level, and the proper product style, only 3 to 4 changes are needed during a 24-hour period. If your residents are currently being changed 6 to 8 or more times per day, a reduction in the number of product changes is a significant savings of time for your caregivers, not to mention less risk of a caregiver's shoulder or back injury often caused when changing a resident. And because the entire Seni product line is fully breathable and super absorbent, a resident's skin integrity will remain healthy without the risk of bed sores or UTIs. Residents will have better clinical outcomes and more dignity and more confidence when using Seni products. Caregivers will have less sheets to change because Seni products have inner leak guards. There will be less stress and less worry for everyone involved. Together, we can help solve some of the contributing factors to the current staffing crisis. Contact us today for a free Seni product trial and see for yourself what a difference a change in product can make.